cystic fibrosis, and environmental factors. First, we'll start off with how CF is contracted. To have CF, you must inherit 2 copies of the CFTR gene that contain mutations, 1 copy from each parent. That means that each parent must either have CF or be a carrier of the CFTR gene mutation. CF is a rare disease, but one of the most widespread life-shortening genetic diseases. Females and males are equally affected. There's no cure for CF, and the effects are lifelong. Maintenance of the disease is the only plan. The average life expectancy is 42 to 50 years of age, while males tend to live longer than females by only a few years. Areas of the body affected and how. The body naturally creates secretion, sweat, and bile, all to help the body function properly. But with CF, the body's secretions become extremely thick and glue-like, making it difficult for our organs to do their jobs. Sinuses and lungs develop recurrent infections and have really thick mucus and inflammation, making it hard to breathe. With time, the lungs become injured and scarred from all the thick secretions and the disease itself. In a patient with CF, when the body sweats, the skin is much more saltier than the average person, and this is often how the disease is actually diagnosed. And in the liver, pancreas, and intestines, they all work together in digestion, but when a CF patient has issues, they have issues breaking down fat-soluble vitamins, all foods, they become malnourished and get constipation. There is an 85 to 90% chance every CF patient will get exocrine pancreatic insufficiency. Many pancreatic issues, the patient may also get diabetes. Along with all these other issues, the reproductive organs are also targeted by the disease. About 97% of men are infertile due to absence of the vas deferens, no sperm, or abnormally shaped poor motility sperm. With the females, they have issues reproducing simply because of malnutrition and or thickened cervical mucus, making it difficult for sperm to travel. Pollution, dust, temperature, humidity, smoke, illness, and infections are all triggers of CF. The more the average CF person is exposed to all these triggers, the more damage there is done to the lungs, always making it harder to heal and making them more susceptible than they already are to infections. Being that they are already immune compromised, they should avoid all these triggers along with being around any sick individuals. Along with illness, pollution has to be the biggest trigger CF patients can face. Pollution is only getting worse as we speak, and if we don't start to change anything about the way we live, the world is only going to get worse. 16% of all deaths worldwide are due to pollution. Of course, it depends on where we live based on the pollution we're getting, but it is a problem globally. Being there is no cure, maintenance really is the only option to treat CF. Of course, treatment kicks in once there's an illness going on in the lungs or in the body, with typical antibiotics and steroids. But CF patients need to keep in close contact with their primary care physicians and multiple specialists. They have to take their maintenance drugs to keep them from having flare-ups and also avoid any triggers. And down below are my references.